is a bowel puncture possible medical malpractice in Maryland? And what are attorneys looking for if you have this type of issue? Hello, I'm Marcus Boston.
And I'm Renee Boston.
And we are both medical malpractice attorneys practicing law in the state of Maryland. And we are joining you today live from the beautiful Greenbrier Park here in Hagerstown, Maryland. Now, back to the video. We have a couple of people who contact us, and we see that there is a lot of confusion with the issue on bowel punctures. When is it medical malpractice? When is it not medical malpractice? When should I contact a lawyer? When should I not contact a lawyer? So to help you understand this better, we're going to give you two fact patterns, and we hope that you can see the difference between the two. And for that, here's Renee.
The first one I'm going to give you is a lady that had a C-section done. And during the course of her C-section, her bowel was punctured to remove the baby. I believe it was a few days later, she started experiencing abdominal pain, severe cramping, diarrhea, things like that, and discoloration of the skin. She was taken by ambulance to the emergency room and diagnosed with a bowel puncture, and her bowel had not been repaired at that time. The second scenario was a lady that contacted us about having a hysterectomy done. She had the hysterectomy done. The bowel was punctured during the course of the hysterectomy procedure. However, the doctors began to repair it, and she had a little bit of abdominal pain and cramping, but after a few days, her injuries and her pain subsided.
So hopefully with these two fact patterns, you can see the difference. Now, the two things that attorneys are looking for in these types of situations, two of the main things that attorneys are looking for is, number one, was a repair done when the bowel was punctured? Did the doctors notice the perforation? And if they did notice it, did they go ahead and immediately repair it? What can happen is doctors will go in and they will puncture the bowel and they will not notice it. And then this can cause leaking into the abdominal area. And now we get to the second thing that the attorneys are looking for. They're looking at, what are your damages? Do you have any long-term issues as a result of the bowel puncture? For example, are you dealing with renal failure? Are you dealing with a massive sepsis infection and things of that nature? So that is what attorneys are looking at when you are dealing with, two of the main things that attorneys are looking at when you are dealing with bowel puncture cases. Now, we realize that if you're watching this video right now, you have questions, you have concerns, you're wondering whether your bowel puncture is medical malpractice. Well, if your matter happened here in Maryland, this is what we invite you to do. Go ahead and pick up the phone and give us a call. We can be reached at 301-850-4832, or if you prefer, you can send us an email to medicalinjury@bostonlawllc.com. We answer questions like yours all the time, and we will be glad to listen to your story. Well, guys, that's it for today's short educational video. Again, I'm Marcus Boston.
And I'm Renee Boston.
And we will see you next time. Guys, enjoy the rest of your day.